I'm David Nielsen. I'm the Director of Internal Operations and Information Technology with Catholic Medical Partners, which is an IPA out of Buffalo, New York, where we have around about 1,000 physicians, 4 main hospitals, and then we've started contracting with a couple smaller hospitals, mental health facilities, as well as ambulatory surgery centers. CMP has had risk arrangements with multiple health plans going back to the early days of the organization around 20 years ago. But about 7 years ago, or actually more like 8 years ago, we switched over to more of a clinical integration model where the data became more important than just the straight financial dollar and cents. We needed to get the quality information, and so we can actually integrate some of our providers. Right now we're getting data from 7 different health plans, each one in a different format, different layout, different data elements from each one. And that has always been a challenge, trying to standardize those into a common format so we can actually aggregate that data for the providers. The advantage of working with Milliman is we were actually able to standardize all of those formats. Prior to contracting with MedInsight, we really were dependent upon the health plans providing all the information. We would be able to know that we were gaining or losing on the contracts, but we really weren't able to drill down to what was causing the information. Is it prescription coverage? Is it radiology? Is it physician services? Is it inpatient? Having that granular level and the various views that MedInsight provides for us, we're actually able to identify, on contract A, inpatient medical admissions are going up where it's going down with our other contracts. We need to take a look quickly. Is that something with the benefit design, the contractual arrangement that we have with that payer, and adjust it when appropriate, or put interventions in at the office or at the site of service to reverse a negative trend or to improve a positive. In the past 5 years, we have not had an aggregate loss on all of our contracts. We may lose based on underwriting issues on one contract, but that's offset by gains in the other. So since we've had you, we have not had a negative year. One of the smartest decisions over the past 5 years was to switch over to MedInsight from our previous vendor.